True anatomical shrinkage of the genitals does not occur simply because someone stops having sex. Some doctors explain that in men, the penis is not a muscle that loses mass like an unused bicep. Its size is determined by its structure and genetics, not by the frequency of sexual activity. However, long periods without erections can cause subtle changes in the blood vessels inside the penis, reducing their flexibility and making erections slower or less firm over time. This is not the same as losing length or girth permanently, and these changes can often be improved with regular stimulation and good circulation. In women, the same principle applies. The vagina itself does not permanently shrink from abstinence, but vaginal tissues rely on blood flow, hormonal support, and occasional stretching to stay supple. Without sexual activity, especially after menopause, there can be a gradual decrease in elasticity, along with dryness. This can make intimacy feel tighter or less comfortable, but these effects are reversible with stimulation, local estrogen treatments, or other therapies recommended by a gynecologist. Medical research consistently shows that what many people perceive as shrinkage is often just a temporary loss of tissue flexibility or a change in the way the body responds to arousal. These changes are linked to vascular health, hormonal shifts, and natural aging, not to abstinence alone. Regular stimulation, whether with a partner or through self-touch, helps maintain blood flow and keeps tissues responsive. Believing the myth of permanent shrinkage can lead to unnecessary worry and even avoidance of intimacy. Understanding the real causes allows for practical steps to maintain sexual health. With patience, consistent care, and healthy habits, both men and women over 50 can keep their bodies ready to respond, no matter how long it has been since their last sexual experience. A prolonged lack of erections can gradually affect the health of the blood vessels inside the penis. Urologists explain that these vessels need regular expansion to maintain their elasticity. Without it, they can become less flexible, which may slow the ability to achieve an erection or reduce its firmness. This change is not the same as permanent damage, but it can make sexual activity feel less responsive over time. The underlying issue is usually reduced circulation, which is influenced by age, overall vascular health, and how often the tissues are engaged. Some doctors recommend that men over 50 think of erections as a form of gentle exercise for penile blood vessels. Just as walking keeps leg muscles and arteries in shape, erections, whether from partnered intimacy or self-stimulation, encourage healthy blood flow and oxygen delivery to the erectile tissue. This helps preserve the smooth muscle fibers and elastic structures that allow the penis to fill and stay firm. Without this activity, those tissues can stiffen slightly, making the return to full erectile strength slower when sexual activity resumes. Medical studies have also linked erectile responsiveness to cardiovascular health. Because the penile arteries are smaller than coronary arteries, changes in their function can sometimes be an early sign of broader circulation issues. That is why some specialists encourage men to pay attention to any noticeable changes in their erections, even if they are not currently sexually active. Addressing high blood pressure, diabetes, or cholesterol can improve both heart and erectile health. Gentle, regular stimulation, combined with healthy lifestyle habits, can help maintain vascular responsiveness regardless of relationship status. This does not have to involve full sexual intercourse. It can be as simple as touch that produces an erection a few times a week. By doing so, the erectile tissues stay well supplied with blood, and the body is better prepared to respond when the opportunity for intimacy arises, whether that's after months or many years. Extended abstinence can subtly influence prostate health in men over 50. Research, including large-scale studies published in medical journals, has shown that regular ejaculation may lower the risk of developing prostate cancer. Some doctors believe this is because ejaculation helps clear potentially harmful substances from the prostate gland and keeps the fluid within it moving, reducing the chance of inflammation or stagnation. While not having sex for years doesn't guarantee prostate problems, the absence of regular ejaculation may mean missing out on this potential protective effect. The prostate is a small gland located just below the bladder, and it plays a key role in producing seminal fluid. Over time, without frequent release, secretions can remain in the gland for longer periods. Although the body can naturally absorb old seminal fluid, some urologists suggest that regular emptying through ejaculation may support better long-term prostate health. This can be achieved through partnered intimacy or self-stimulation, making it accessible even for men who are not in a sexual relationship. Beyond cancer risk, maintaining prostate function can also influence urinary health. A healthy prostate is less likely to swell or cause pressure on the urethra, which can lead to difficulties with urination, especially in later years. Older men often face age-related prostate enlargement, and keeping the gland active may help it remain in better working condition for longer. It's important to remember that prostate health is influenced by many factors, including genetics, diet, exercise, and overall hormonal balance. Ejaculation is only one part of the picture, but it's a simple and natural way to support this vital gland. For men over 50, integrating regular sexual release into life, whether through intimacy with a partner or personal self-care, can be a practical step towards reducing certain risks and promoting comfort and function well into the later decades. Without regular sexual activity, especially after menopause, vaginal tissues can gradually lose some of their natural elasticity and moisture. Gynecologists explain that estrogen plays a central role in keeping these tissues thick, flexible, and well lubricated. When estrogen levels decline with age, the vaginal lining can become thinner and drier, and the absence of regular stimulation can accelerate this process. The result is often a feeling of tightness, reduced stretch, and more friction during intimacy. These changes are not dangerous, but they can make sexual activity less comfortable and may discourage women from resuming intimacy after a long break. Regular stimulation, whether from partnered intimacy, self-touch, or even certain pelvic floor exercises, helps increase blood flow to the vaginal area. This improved circulation nourishes the tissues, encourages natural lubrication, and helps maintain their flexibility. Some doctors recommend that women who are postmenopausal and not currently sexually active still engage in occasional vaginal stimulation to keep these benefits. In cases where dryness is significant, vaginal moisturizers, lubricants, or topical estrogen treatments prescribed by a healthcare provider can restore comfort and tissue health. Studies have shown that women who maintain some form of sexual activity tend to experience fewer symptoms of vaginal atrophy and are better able to resume intimacy comfortably even after long gaps. This is because the tissues remain accustomed to gentle stretching and blood flow, making the return to intercourse smoother and less intimidating. Ignoring these changes can sometimes lead to a cycle where discomfort causes avoidance, and avoidance allows the tissues to become even less elastic. Breaking that cycle often requires a combination of gentle physical reintroduction, medical support if needed, and reassurance that these effects are common and treatable. For women over 50, paying attention to vaginal health, whether or not sex is currently part of life, can preserve comfort, confidence, and the option for fulfilling intimacy in the future. After years without sexual activity, the first attempt at intercourse can sometimes be physically uncomfortable. Doctors explain that this is often due to reduced elasticity in the tissues, lower natural lubrication, and a decrease in regular stretching of the muscles involved in intimacy. In women, especially after menopause, this may mean the vaginal tissues feel tighter and more sensitive to friction. In men, reduced frequency of erections may make arousal slower to build, leading to tension and discomfort during the act. These changes are not permanent, but jumping straight into full intercourse without preparation can make the experience unpleasant. Gradual reintroduction is often the most effective way to restore comfort. This can involve starting with non-penetrative intimacy, gentle touch, or light stimulation to encourage blood flow and allow the body to relearn its natural responses. For women, using a good quality lubricant or a vaginal moisturizer can significantly reduce friction, while topical estrogen treatments prescribed by a doctor can help restore natural elasticity and moisture over time. Men may benefit from regular erections, whether through partnered intimacy or self-stimulation, to keep blood vessels responsive and tissues supple before attempting intercourse. Some specialists recommend viewing this phase as a process rather than a single event. Approaching intimacy slowly with patience and communication allows the body to adapt and reduces the risk of pain or frustration. Even after years of sexual inactivity, the body is capable of regaining comfort and responsiveness when changes are introduced gradually. By easing back into intimacy with preparation and care, it is possible to replace discomfort with a renewed sense of physical connection and confidence. Sexual activity triggers the release of several key hormones that influence mood, stress levels, and emotional connection. Oxytocin, often called the bonding hormone, is released during intimacy and physical touch, fostering closeness and trust between partners. Dopamine, the brain's primary pleasure chemical, creates a sense of reward and satisfaction. Endorphins, the body's natural pain relievers, bring about relaxation and reduce feelings of stress. Without regular sexual activity, the body produces these chemicals less frequently, which can subtly affect emotional balance. Lack of sexual connection over an extended period can influence emotional well-being in noticeable ways. Some doctors explain that reduced intimacy may contribute to higher stress levels, irritability, and mood swings. Without the hormonal benefits that come from sexual activity, particularly oxytocin and endorphins, the body may have a harder time regulating emotions, leading to feelings of restlessness or frustration. Over time, this can also affect interpersonal relationships, as irritability and tension can make communication more difficult. Self-confidence is another area that may be impacted. For some people, long gaps without intimacy can create doubts about attractiveness, desirability, or sexual ability. This is often tied to body image concerns that may become more pronounced with age, such as changes in weight, skin, or hair. These feelings are not a reflection of actual worth, but can still weigh heavily on self-esteem, making it harder to approach or accept future intimacy. Research on emotional health in older adults highlights the role of positive physical connection in reducing anxiety and improving life satisfaction. When that connection is absent, it's important to find alternative sources of emotional support through friendships, social activities, or non-sexual physical affection to prevent feelings of isolation from taking root. Addressing the emotional effects of sexual inactivity involves acknowledging them without judgment. Recognizing that stress, irritability, or self-doubt may be linked to a lack of intimacy allows for intentional steps toward improvement. Whether through rekindling a sexual relationship, exploring self-intimacy, or simply increasing affectionate touch in daily life, taking action to meet these emotional needs can restore a greater sense of balance, confidence, and calm. Over time, this approach helps ensure that emotional health remains strong, even during periods when sexual activity is limited or absent. Long periods without sexual activity can sometimes lead to anxiety about returning to intimacy. Specialists describe this as performance anxiety or fear of judgment, which may appear when someone worries about how their body will respond after years of inactivity. This anxiety can be heightened for people over 50 who may already be adjusting to natural changes in sexual function, stamina, or appearance. The concern often centers on whether arousal will occur easily, whether physical comfort will be maintained, or whether a partner will be satisfied. Such worries can create a cycle in which fear makes physical responses even slower, reinforcing the anxiety. Medical and psychological experts recommend breaking this cycle through gradual re-exposure. This might mean starting with low-pressure physical closeness, holding hands, light touching, or non-sexual massages before progressing to more intimate contact. By removing the immediate expectation of full sexual performance,
the body and mind can reacquaint themselves with pleasure in a calm, controlled way. Self-compassion is an important part of this process. Accepting that responses may be different than they were years ago helps reduce self-criticism. Many changes are normal with age and can be adapted to with patience and communication. Some people find it helpful to discuss these concerns openly with a partner, setting the expectation that intimacy will be reintroduced slowly and without pressure. Studies in sexual health have shown that with repeated, gentle experiences of closeness, both confidence and physical responsiveness tend to improve. Over time, what began as anxiety can transform into comfort, trust, and renewed enjoyment of intimacy. This approach allows the return to sexual activity to feel safe, relaxed, and fulfilling, even after many years apart from it. Fertility naturally declines with age due to hormonal changes and a gradual reduction in egg or sperm quality, but abstinence alone does not cause permanent infertility. Specialists in reproductive medicine explain that in men, sperm production is continuous throughout life, although volume and motility may decrease over time. Even after years without ejaculation, the body continues to produce new sperm, and older sperm cells are safely reabsorbed. This means that a man who has been abstinent for years can still father a child, provided other aspects of reproductive health are intact. In women, the number and quality of eggs declines steadily from the mid-30s onward, with a sharper drop after menopause. This decline occurs whether or not sexual activity takes place because egg release is controlled by the menstrual cycle and not by intercourse. Once menopause is complete, natural conception is no longer possible, but this is due to age-related ovarian changes, not to abstinence itself. Some people believe that long gaps without sexual activity shut down fertility, but medical evidence shows that this is not accurate. What matters most is overall reproductive health, which is influenced by age, hormonal balance, underlying medical conditions, and lifestyle factors such as nutrition, exercise, and stress management. For those wishing to conceive later in life, doctors often recommend fertility testing to assess current potential rather than making assumptions based on past sexual inactivity. Abstinence may affect emotional readiness or comfort with intimacy, but it does not directly cause the loss of fertility. Understanding this distinction can help reduce unnecessary worry and encourage a realistic approach to reproductive planning at any age. Libido can temporarily decline during long periods without sexual activity, but this does not mean desire is gone forever. Sexual interest is influenced by hormones, brain chemistry, emotional connection, and physical stimulation. Without regular intimacy, the brain may become less accustomed to producing the dopamine and testosterone surges associated with arousal, making sexual thoughts or impulses less frequent. This is a normal adaptation and not a sign of permanent loss. Medical research shows that sexual desire often returns when physical or emotional intimacy is reintroduced. For men, regular erections, whether from partnered sex or self-stimulation, help maintain healthy blood flow and nerve responsiveness, which supports arousal. For women, gentle sexual stimulation and the use of lubricants or moisturizers can make the experience more comfortable, which in turn encourages desire. These actions reinforce the brain-body connection that drives libido. Some doctors note that emotional closeness plays a large role, especially for those over 50. Shared affection, open conversation, and non-sexual touch can build anticipation and help awaken dormant desire. Even small steps toward physical connection can signal the body to restart its natural arousal processes. It's also common for libido to increase gradually rather than all at once after years of sexual inactivity. Patience, realistic expectations, and regular stimulation can help the process feel natural and pressure-free. By reestablishing both the physical sensations and the emotional cues linked to arousal, it's possible to reignite sexual interest at any age. This approach allows desire to return as a comfortable and welcome part of life rather than something forced or rushed. Even without a partner, self-intimacy can play a valuable role in maintaining sexual health after long periods of inactivity. Doctors in sexual medicine explain that gentle self-pleasure supports blood circulation in the genitals, helps preserve tissue flexibility, and maintains nerve sensitivity. This activity can stimulate the release of hormones like dopamine and oxytocin, which improve mood, reduce stress, and create a sense of well-being similar to that experienced during partnered intimacy. For men, regular erections achieved through self-stimulation keep the erectile tissues oxygenated and responsive, which can make future arousal easier. For women, gentle sexual stimulation and the use of lubricants or moisturizers can make the experience more comfortable, which in turn encourages desire. This can be especially helpful after menopause, when hormonal changes make dryness and reduced elasticity more common. Medical specialists often emphasize that self-intimacy does not need to be goal-driven or rushed. Slow, mindful exploration allows the body to respond at its own pace.